In the GREG project, you will hear a lot about patient involvement. Let's explore what we mean by it and why it is essential to the project. In GREG, patient involvement means that patients are not just consulted or informed,
but actively help shape project plans, priorities, and decisions. It's a true partnership.
That's right. It's about working with patients through the Patient Advisory Group, ensuring their perspectives influence key stages of the GREG project.
So, how do we make patient involvement meaningful?
The GREG Consortium proposes the following quality criteria based on current best practices and guidance on patient involvement. First, transparency, making clear how patient input is used. Then, inclusiveness, making sure the right voices are in the room. Influence, because patient insights should lead to real changes. And finally, respect, recognizing contributions fairly and creating a positive, collaborative environment.
Let's see how this works in practice. The GREG project brings patient involvement principles into the field of real-world evidence studies.
Patients can provide input on study design, data collection approaches, and the outcomes that are most meaningful to people living with the condition.
In GREG, patients are systematically involved as partners throughout the project lifecycle, in all work packages contributing to the planning and execution of all activities, and the dissemination of project outcomes.
The Patient Advisory Group serves as the project's central mechanism for patient involvement, ensuring meaningful contributions across all activities and supporting the systematic monitoring and evaluation of patient involvement.
Let's explore some examples of patient involvement across the GREG project.
The Patient Advisory Group helps to co-design research questions and use cases.
Patients contribute to the design of research questions and use cases to maximize patient impact.
The Patient Advisory Group enables the co-review of research activities.
Patients co-review research activities and study materials, providing feedback throughout the project.
The members of the Patient Advisory Group are actively involved in the project work. For example, patients will be involved in creating lay language summaries of the generated real-world evidence guidance and use cases, and by co-authoring an e-learning course on real-world evidence addressed to patients.
This co-creation process helps ensure that materials are accessible and communicated in a clear and understandable way. It's collaboration in action, science translated into everyday language. The Patient Advisory Group contributes to the review of dissemination materials, helping ensure that publications, presentations, and reports accurately reflect what matters to patients. This final feedback loop helps ensure that results reach the right audiences in the right way.
And that's how the GREG project translates patient input into sustained impact across the project.
Quick check. What does patient involvement mean?
A. Consultation only, or B. Partnership in decisions.
What do you think?
If you said B. Partnership in decisions, you're absolutely right.
That's the essence of meaningful involvement.
One of the partners in the GREG project is EFPIA, the European Patients Academy on Therapeutic Innovation, which works to strengthen patient involvement in research through education. More information is available on the EFPIA website.
There, you'll find resources, templates, and publications on how to implement patient involvement in your own work. To discover more about GREG and our activities, visit the GREG website.
Together, we can make research more inclusive, transparent, and patient-centered.